Hello and welcome to another episode of our uh, feedback series. And this interview today is with Dr. Jana, and we're going to talk about AKT coaching. So, Jana was one of our trainees who took the AKT coaching program with Wellmedic, and she's here today after her April exam in 2024 and having passed, and she's going to share some experiences. So, thank you for joining us, Jana. So, tell us a little bit about yourself, where you train, where you are at your training at the moment.
Um, I am GPST3 and I'm training in Scotland is on 5 and my GP practice is in Kilcardy.
Perfect. And you before you came to be a GP trainee, you were in anaesthetics. Is that right?
Yes, I did anesthetic for 14 years.
Why the change from anaesthetics to general practice?
See, the COVID changes a lot of people life, and that was I was thinking to change to do. When you're getting older, you want to do something you don't need to do nights.
Fair enough.
That was one of the reason, and I accomplished as much I could accomplish in that what I was doing anesthetic. Then I said that it's time for change. That's what the one reason, and COVID and stress of the COVID because anesthetic doctor they were the most busy people. That was the second one, and
Makes sense.
like and better like time for yourself, and you can choose how many hours you want to work if you want to do other hours or not. You can choose your actually time how much you spend.
Yeah, yeah. Do you feel that you've made the right choice? Kind of having reflected a few years on now.
I think so. Yeah, I like both. I
Good.
like I like both. In something they were similar, because anesthetic is 1-to-1, and the GP practice is 1-to-1. It's nicer job than work in the hospital when you have plenty people and you have to run. It's nicer than you have just connection with one person. But this one is talking to you, and anesthetic they mostly sleep.
Yeah, of course, that makes sense. And on that note, on the note of stress, so I know that this exam caused quite a lot of stress for you in terms of it was you'd already taken the exam before working with us. So what was that process like? How did you manage, the stress of not passing first time around and then having to recalibrate to then take it again?
I actually didn't pass. This was my third attempt.
Hmm.
That when you're doing something third time and you have had know that after that you have only one attempt, then I say I need to change my strategy. And then when I was looking, that when I find your courses first, I was looking how to improve my evidence-based medicine and my administration. Plus, if you are international graduate, your some and English is your not first language. Some like admin can be a bit tricky
Hmm.
because the formulation, like basic language, you can speak, you don't have problem with the patient, but the formulation on the language is a little bit different. That's even in my language. Formulation for administration for letters is different than
Yeah.
when you're using normal formal language. That was the one, and that's what I was looking for, some good course, and that's how I found you. Initially I was listening this little episode, like 3 minutes episode
The podcasts. Yeah. Yeah.
podcast,
Yeah.
and I find that interesting. I learn a little bit from different topics, and then I saw that you doing like through combination, like clinical part, admin, and statistic, and was actually even affordable. Like if you compare with the prices with other courses,
Yes. Yes.
then I purchased that and started to do them by one. But like there were couple models in which section and try to complete them, and it was good because it was everything in one place. Because you can find statistic on the internet somewhere else, but you don't have dense things on one place, and that's why I like the courses.
Yeah. So you're talking about the kind of the video modules here. How did you find them in terms of their thoroughness? So you took so the admin package was updated in January 2024. So we
Yeah, yeah.
re-recorded everything and we updated it so that it was in line with guidelines. How did you find the thoroughness? Do you feel it kind of covered everything that you needed for the exam? Do you feel that there was anything that we could do maybe slightly better?
Um, Admit, I think they cover like most like 90% things you need for example, probably because you still have to find the other stuff. And from the statistic, I think the cover most of time.
Good.
Or if you don't know something, you can still, if you want to have deeper knowledge, you can, what you have to look for. That's
Yeah.
right,
Good.
to put
Good.
it that
Yeah.
way.
Because we always talked about this, didn't we, when we were doing the coaching, was that, ultimately it's about building that strong foundation of statistical knowledge and that strong foundation of admin knowledge, and then being able to apply yourself. And I think that's what we worked on in the coaching program, wasn't it? So for those of that are listening, we offer two different things. There's the packages, which are the courses where you can do it in your own time, and then the coaching is this kind of more to one-to-one kind of element of the program. What did you think? What was the kind of defining factor from you to go from a course user to being a coaching user? Talk me through that process.
Okay, then you do some study days. Then
Yeah.
I went for like, it was online. I was off. Then I was doing study days. There were questions there. You offering that, and I say like I say myself, I need to pass this exam because it's putting my like stress on your future,
Hmm.
and stress you like you feeling, if you fail something, you feel like you're not complete. It's
Of
just,
course.
it's that's a horrible feeling. And then I say maybe that is the right way to go. And I was doing coaching from the NES, from the
From that
NES.
study there. Yeah.
No, 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 coaching through our body, like the organization who help people if they have trouble.
Ah, yes, of course. Like the dean who sets up their
Yes, and
their kind
they
of
made
SOC
a set
support.
up
Yeah.
some coaching for me, and I find
Yeah.
that useful. And I
Hmm.
say, okay, if the antenna, I did some other course for not coaching, for something else, and they we did some like coaching type in the course. Then I
Hmm.
see, I think this is the way for me to get this exam done.
So kind of
That's
everything aligned leading up to that study day, and then you thought that was the right time for you to engage in our coaching. Okay,
Yeah,
that that.
and plus
Mm.
other things was good, because we get some discount. We can pay monthly
Yeah.
because all these exams is expensive, and I say, okay, then if I can pay like £50 a month and do coaching, then I was happy. That's the way for me to go.
Yes, of course. We try to make it as cost effective as possible. So, what Jan is saying really there is that when you're already a course user, we actually discount that from the coaching price, so we don't charge people twice because we don't want to have people using the coaching if they're not using the courses as well. So we try to do it in tandem, so that the coaching sessions therefore ultimately become about kind of fine tuning things within your understanding. So if I go through the coaching with yourself and just remind you in terms of what we did over those 5 sessions. So initially we did the baseline assessment, and as you rightly mentioned, we recognised, as you did as well, that statistics and admin needed some degree of work. And then the second session we did was on graphs. The third session that we did was on calculations. The fourth session that we did was endocrine and calculations because I
Yeah,
wanted to bring some clinical element into it, and I still felt the calculations needed a bit of help. And then finally, we did the admin. What did you find helpful about those one-to-one sessions in terms of what we were doing or how we were approaching things?
you remember when you asked me if I pass exam, I told you yes, and I say you give me some kind of confidence that I know enough
Yes,
to pass this. Then I am approaching the question right away to find the clue what is the right answer, and that was like you increase my self-esteem or and confidence that yes, I can do it.
excellent, excellent. That's
And
really kind of you.
that is very important when you go for exam, especially when you fail exam before.
Yeah, yeah, absolutely. I think that was a key thing, wasn't it? Because sometimes there were questions that were quite tricky when we were working together in the coaching, and the impression that I was getting, if I have a look back through my notes, was it was almost that you approached the question completely, or even before you answered the question, you would say, "Oh, this is really tricky. This is too hard," and it was trying to change that mindset of let's not say that first, let's break the numbers down, let's extract the information from the question and then see how you can approach it. So no, you're very right, that's very much what we did though during those sessions. Now, if there was, because you've had kind of three experiences of the exam, you've had the two experiences where you didn't pass, you've had the one experience where you now have passed, and that burden of the AKT has been taken off your shoulders. If there's somebody else in your position, coming up to taking this exam for their third time, they're an SD3, they've also got to take the SCA, they're fast approaching that CCT.
Mhm.
What advice would you give them in terms of how to manage that stress and try and reset for taking that exam again?
Believe first they need to believe they can do it. That's I would say. To find what is the best way for them to improve. Like I know that I need to improve my statistic and my admin, and what part is weakest like link in their knowledge then, and still because I've calculated I study for exam it's like 6 months,
Hmm. Hmm.
including CSA preparation.
Hmm. Hmm.
But you need to always have some time for yourself. Just go for swim, go for walk, whatever works for you, jogging, and meet the friends. You need to have the days off when you're actually not studying as well.
Absolutely, absolutely, yeah, yeah. I remember you're absolutely spot on. I vividly recall one of our sessions. Were you in a friend's dental practice, if I remember correctly?
Yeah, yeah,
Yeah, yeah. So again, it's about finding different environments to work in as well, just so that you're getting out of your kind of room in your house. So no, I think that's really, really important. Um, one final question, because you've worked in a couple of different health services, in the sense that if memory serves me right, you've worked here in the UK, you've worked in Ireland,
And
and I
before
think
that,
you
I am Slovakian graduate.
and you're
Yes.
Slovakian graduate, so you've worked in kind of three different systems. For somebody who is coming through the exam process and they they've experienced different healthcare systems and they're preparing for things like admin, which is very kind of UK centric in terms of the approach that you follow. How did you kind of find that process of trying to kind of detach yourself from how that maybe be approached in Ireland or Slovakia, and how you would approach that? Was that quite a difficult transition? And is there any advice that you could give to somebody who's in a similar position to yourself?
When you come from different, first, I learned medicine in my own language. That's
Hmm.
one thing. Some people, even they are from like India, they still study medicine in English. I could say, yes, you need to just concentrate whatever they want from you, because I have to read all these GMC advice pages, a lot of stuff to understand actually what is some question about. So that was just I think the exam is not problem. The problem is your technique. You have to find the techniques which will work for you, and
Exactly.
that's then I was saying myself I need to find something which can help me to get through. And first was what your course like
Hmm.
admin and stats, and the second was the coaching was helpful for me as well.
Good. Good. No, it's really
Also,
good to hear that.
I improve my statistic. I think statistic about 30%, and I
Wow.
improve my admin about 40%.
Wow. Excellent. Excellent.
That's
Excellent.
that's a lot.
It's very substantial, isn't it? And
And,
I
and
think the first thing I said to you when you said to me, "Oh, Sham, I'm thinking about the coaching," I'm pretty certain that I said to you at the time, like, if you can't bring stats and admin up, it's very, very hard to pass that exam. It's so heavily based on that 20% that comes from there. Clinical is so vast; it's very different every exam, but boosting that admin and stats, because it's so specific and because the curriculum's so specific about it, it's a really good way of boosting your marks. So
but
first,
even
sorry,
I
you go to say?
I want to say the mock exam I did. Oh, they were very tough, but I think the exam is the similar level. It's tough. It's like I did plenty exam from anesthetic in English as well,
Mhm.
but I, I find this exam the most difficult.
We talked about the mock being challenging, didn't we? And you said it was a challenging mock, the one that we offer, which is the 400 questions. And actually, for people who are going to be taking the AKT from August onwards of 2024, there's going to be even more questions coming from well medics, so we're adding even more questions to our syllabus. So that's really helpful. And as you said, it's not an easy exam. I think taking this exam lightly is often a big problem for people because they approach it in a similar way that they would have approached other kind of exams that they might have taken, like the MSRA, for example, or PLAB 1 as well. So, yes, you're right. The challenge is definitely there. So, thank you very much, Jana. It's been a pleasure speaking to you. I wish you all the best with the rest of your career, and I'm sure we'll keep in touch. Thank you very much.
Okay, thank you so much. Okay, bye.